My name is Isaac Hembree. I am a third year medical student at UTHSC in Memphis, Tennessee. How I got into medical school, I always, as a kid, dreamed about being a doctor and didn't really know what that meant until I kind of got a little bit more involved in the application process, volunteering and shadowing at hospitals. And somehow I just kind of lucked out and picked a profession at a really young age that I became interested in as an adult. And so far, I think that my intuition was pretty good as a little kid. So, first off, I did the virtual abstract in August, and I was presenting an update on some of our alpha-1 antitrypsin research. And I thought it was a great opportunity for me to showcase those updates. And then to go to Atlanta, I had to place in the top 10, and I was thrilled even to be in the top 10, let alone winning the poster abstract award in Atlanta. So I got to go to Atlanta, and it was just a great experience for me. One, just going to conferences is awesome to get to meet physicians from the area and medical students. So it was just amazing to even be there. And then the award on top of all that, it was such a great experience. Yeah, so I think that, research is something that is necessary for, medical students and residents and attendings, for career advancement, it's great, but also just, that's kind of how we get updates on different fields of medicine and how we come up with, new treatments and, uncover new knowledge for how we can help patients out. So just in terms of presenting, you know, regardless of what you're presenting, I think just public speaking skills is a really important thing. And just being able to, kind of talk about, what you've done. You have the poster, but there's always a little bit more to the picture. So I think just being able to talk to people about what you've been doing and, people being interested in what you're doing and showing interest is also, it helps in terms of like motivation. So that helps you like continue to um, work on those projects because they can be really, long and grueling. So just to have some type of fruit of your labor is a really good thing. Yeah, so medical student or medical school is expensive. I'm sure that most physicians can attest to that. And I have to use loans to help fund my education. So in terms of the money that I get from FAFSA, this just adds to that. It makes going to medical school more affordable for me. In my fourth year, there's some big things that are coming up. Residency applications are on the horizon. So I know that will be an additional cost to be able to pay for that. And also, something that this actually I'm really considering. I've been really interested in wilderness medicine, and there is a fourth year elective that is available through the University of Utah that takes place in the Alps in France. So I'm potentially thinking about doing that. I at first didn't think it would be possible just for monetary reasons, but because I, somehow won this amazing award, that makes this trip a little bit more possible. So that's something that I'm thinking about. But if I do go, I would have to owe it to SMA to help me to get there. Yeah, so I how I kind of figured out about SMA was Dr. Jackson, he was employed by UTHSC, and I saw that he had been appointed to to be a president of SMA. And I didn't really know much about it at that time, but I had been involved with some other organizations in my state, and I knew that, I want to practice medicine in the South. Regardless of where I go for residency, I kind of see myself kind of circling back here. So I wanted to kind of get some ex or exposure to, physicians from across the state, medical students from across the region. And so I just kind of signed up, and this was really my first true experience with SMA. I get the messages that they receive, but I did the virtual abstract competition, and then that led to going to Atlanta. And it's been amazing so far. I know that I'm going to continue to be involved. The physicians and trainee committees, I don't know if they have their applications open or not yet, but I think that once it's open, I'm going to apply for that just to continue my involvement, just to kind of help out more on like an organizational level. So, I definitely, as a medical student, have utilized and seen the value of, these medical organizations and the conferences that are associated with them. And, this is one that I plan to continue to work with. So let's see, residency and, potentially fellowship will take up some time, but hopefully, in 10 years, um, right now my plan is to do medicine for residency, and I'm interested in the fellowship, and the two fellowships that I'm interested in are cardiology and pulmonary and critical care. So in 10 years, I would, hopefully see myself practicing medicine in Tennessee, fresh off of fellowship. And I would either be, in a, hospital doing cardiology stuff, echoes, or in the EP lab, or, doing some interventional cardiology, or, I'd potentially be in an ICU in a hospital somewhere in the South, being a critical care attending. So, and hopefully, volunteering and doing, additional things, like I'm involved with a free primary care clinic. So having some free volunteer work kind of incorporated into that is where I would want to be professionally.
The Southern Medical Association would like to extend a heartfelt congratulations to Isaac. We are so proud of you, and we can't wait to see just how far you'll go. If you'd like to support students like Isaac, please consider donating to our Research and Endowment Fund. You can find us online at sma.org/give.